Good morning. I want to call the meeting of Senate Education and Health to order. I'd like for the clerk to call the roll, please.
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker.
Here.
Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi.
Here.
And Senator Lucas.
Here.
Madam Chair, you have a quorum.
Okay.
Thank you, Mr. Clerk.
Yep.
It appears that we have quite a number of bills and quite a number of people who signed up. And so I'm going to go right down the list based on the patrons.
Okay. What do they do on the transparency stuff? Oh, yeah.
And I want to call on Senator McPike for Senate
Okay.
Bill 5036. Senator McPike?
Okay, thanks.
Is he back there? Zero 4, and that is the patron, Senator Kiggins. Senator Kiggins? 5004. Patron, Senator Kiggins.
Thank you, Madam Chair. I'd like to speak to Senate Bill 5004, and I believe we have a substitute. Did that get passed to everyone? That just has a waiver for schools that are unable to fill the position with a registered nurse. They can use the LPN. There's an application process to school boards.
Could I get a motion on the substitute, please? It's been moved and properly seconded that the substitute be agreed to. All in favor, please say aye. Those opposed? Senator Kiggins.
Thank you, Madam Chair. So speaking to the substitute, this is my school nurse bill, and this is not a new bill for this body, but I think we can all agree that the times are different now and our children are not in brick and mortar schools. No matter what side of the aisle you're on, I think we all agree that we want our children to be back in school for so many reasons that I'm sure will be mentioned today. But we want to do it safely, right? I hear from both sides of the aisle. I hear from the parents who want their students to go back, the students, but also from the people who are concerned, the staff, the faculty, the bus drivers, people who are worried about safety. How are we going to implement this? So the most important person, in my opinion, to have a seat at the table, or one of the most important, is a school nurse who can sit and help with establishing guidelines, protocols. Most importantly, we need a registered nurse to fill this position. This is a person who's a certified nurse who can perform assessments of students. They will be able to help with screenings and quarantines and making sure staff and schools have adequate PPE, how to treat and assess students who may be symptomatic, contact tracing. There are so many jobs that the registered nurse can fill and that are of utmost importance during this pandemic. Having a school nurse in every school is important, not just for now, but even at the end of a pandemic, we'll be able to use them for, their nurses are wonderful health educators, things that we might be missing right now, things like good nutrition, exercise, label reading, all of the things that are important to just good health care going forward, which ultimately will save health care costs if we have a healthier population. So this bill, again, requests that we have a school nurse in every school. This idea has been supported by the Virginia School Nurses Association. I've worked closely with them. The Virginia PTA has been a wonderful source of support on both sides of the aisle. We've gotten some wonderful media attention as well. So a lot of support out there for having one school nurse per building in every school. The idea of having a school nurse in every school is also supported by the American Academy of Pediatrics, the National Association of School Nurses, and the National Coalition of Ethnic Minority Nurse Associations. So COVID-19 will likely require daily multiple nursing assessments in schools, while LPNs and health aides may collect data for assessments. Under Virginia Board of Nursing regulations, only RNs may make professional nursing assessments. RNs who receive formal education in infection control and epidemiology can provide communicable disease surveillance and assistance in determining safe practices for schools. They're essential members of the back-to-school team and a way to get our kids back in school safely. When I was talking to the School Nurses Association, one story that they relayed in one of the localities was about just the health disparities in their school nursing situation. They had a certain pot of money, they could hire a certain number of school nurses, so how are they going to divide that up amongst the schools? They looked at the number of children in the schools, they looked at the number of medications they administered, and they looked at the number of health plans in place. So the schools who ultimately won those school nurses were not the schools that had the lower income student populations. Those kids often can't afford their medications, often don't go to the doctor and have health plans in place. So they were the ones that missed out on that opportunity to have an actual school nurse in place. Also, there's studies out there just talking about the effectiveness and the help of keeping a school nurse in school. The early dismissal rating is lower when you have a school nurse in place. It went from 18% when you just had a health aide or a faculty staff member acting as a school nurse. It went all the way down to 7% when you had a full-time school nurse in place because nurses can assess and determine who needs to stay in school and who needs to go home. With the increasing complexity of student health needs, all students deserve equitable access to professional school nursing services who are on the front line of our healthcare system. I urge you to pass Senate Bill 5004 as a key component to reopening Virginia's schools and getting our children back in the classroom safely. And I believe there are several people to speak in favor of the bill today.
Thank you, Senator Kiggins. You are correct. There are a number of people who have signed up to speak. And so, unfortunately, because we are limited in time based on the number of bills we have and the number of speakers, I'm going to have to get each person to limit their remarks to about 2 minutes.
Madam Chair, can I ask a question of the patron? Madam Chair, yeah, I'd like to ask a question of the patron.
Yes, Senator Edwards, I thought maybe we go through the speakers first and then come back to the members. Thank you. First person signed up to speak is A-R-S-H-I-A, last name Q-A-A-D-I-R. I did not want to mispronounce the name. Do you have her in queue?
Yes, should be in the room.
She's on.
Speaking in favor is Ashia.
Yes. Can you hear me now?
We can
Are you
hear
able to hear
can't see,
me?
but go right ahead.
Yes. You can hear me? Okay. Can you hit that?
We can hear you.
Okay. And, okay, there you go.
There you are.
All right. Sorry. My name is Dr. Arshia Kader, and I am speaking on behalf of the Virginia chapter of the American Academy of Pediatrics in support of Senate Bill 5004, which would require a nurse in every school in Virginia. We recognize the important role school nurses play in promoting the optimal health and well-being of children in the school setting. And now, in the midst of a pandemic, the need for this is even more urgent. As school divisions contemplate the appropriate circumstances for students to return safely to in-person education, the need for an adequately trained, licensed healthcare provider in each school cannot be overestimated. Currently, many of our schools lack even one full-time registered nurse, and others have instead a staff member known as a health aide without any medical training. Our knowledge of COVID-19 informs us that it is a medically complex disease which presents differently in children than in adults and has a wide range of clinical features, from an asymptomatic child to a stomach ache to serious complications like multi-system inflammatory syndrome. The decision-making process involved in evaluating, screening, and quarantining students will therefore require a comprehensive understanding of medical knowledge and updated guidelines. This can only be provided by a licensed nurse in each school working alongside pediatricians in the community. COVID-19 has revealed myriad gaps in our healthcare system, and the absence of school nurses is yet another example of a disparity affecting our children. As pediatricians, we strongly support the work of our nursing colleagues and the vital role they play in mitigating the impact of this pandemic on our children and communities. Thank you.
Thank you so much. Next speaker in queue is Christina Holloway.
Hello? Can you hear me?
We can hear you.
Christina, you're on the line.
I'm actually,
I'm
I'm
sorry.
speaking on behalf
I'm
of
sorry.
Bill.
I think you signed up for another bill, so I'm going to go back to this one first. So I'm
Thank
going to
you.
call up, it appears right in this queue is Angela Moore, 5004. Angela Moore?
Angela, please unmute your mic.
Did we lose Angela Moore? Okay, if she's in queue, we'll come back. The next person for 5004 is Gina Bellamy. Gina Bellamy?
Good morning. Can you hear me?
Yes, we can hear you now. Thank you. Go right ahead.
Okay. Good morning. I come to you representing parents and school nurses across the Commonwealth, seeking your support of Senate Bill 5004. School nursing is one of the most misunderstood jobs in the school system. We are way beyond Band-Aids and boo-boos. School nurses track and address health concerns and trends. School nurses are educated in public health and infectious disease control practices. School nurses help decrease communicable disease outbreak. It was a school nurse in New York, through her astute surveillance and data collection, that alerted the CDC about H1N1. Yes, it was a school nurse. Had it not been for that nurse, the H1N1 outbreak would have been significantly more widespread and probably caused more death. Because of that school nurse's early containment of the virus, containment was possible. To open schools safely, you must have a licensed healthcare professional on site, minimally an RN. RNs are educated and trained to assess, triage, isolate, and refer students if necessary. More importantly, RNs are key to mitigating and containing this virus. It is not a matter of if a student or staff member tests positive, it's a matter of when. And it is the registered nurse with her skills in assessing, triaging, isolating, and contact tracing, and collaborating with the Virginia Department of Health that could make the difference between a containment or a complete shutdown. Ladies and gentlemen, I'm asking you to prioritize funding. Make our school children's health a priority. We are in the middle of a global pandemic. You said no to school children when Delegate Torian presented the school nurse bill in 2015. You said no to school children when Delegate Dudenhofer presented a school nurse bill in 2017. You said no to school children when Delegate Pogue and Delegate Thomas presented a school nurse bill in 2018. You said no to school children when Senator Stewart presented a school nurse bill in 2018, 2019, and 2020. If not now, then when? Now is the time to support school health services. Support this bill.
Thank you very much, and I could hear your voice very clearly.
Thank you.
Next speaker is Jenna Alexander, Virginia, on Senate Bill 5004.
Jenna, you're on the line. Unmute your mic.
There we go. Good morning.
Good
My
morning.
name is Jenna Alexander. I'm the Vice President of Advocacy for the Virginia PTA. I'm here today to speak on behalf of our 165,000 members across 1,000 of Virginia's public schools in support of Bill SB 5004. The Virginia PTA has supported staffing an RN in every building since 1993. That's 27 years. And in that time, we've seen tremendous change in the medical field. And we've also seen an increasing number of our students that have asthma, severe food allergies, diabetes, ADHD, and complex healthcare needs that require catheterizations and tube feedings. Additionally, school nurses, along with the school counselor, school social worker, and school psychologist, serve as an important safety net and first line of care for our students. In fact, students with anxiety often log frequent visits to school nurses and are the first professional that a student sees for mental health concerns. But we are in the middle of a pandemic. There has never been anything more important than the safety of our children. You can't put a price on it. That's why thousands of Virginia's children won't be returning to school buildings to start the school year. I know that the teachers in my children's classroom are professionally educated, trained, and licensed, but the level of training that a school health aide or clinic aide receives varies by school division. When there's an RN in the building, as a parent, I know that my children and their teachers have someone in the building who is college educated in the nursing profession, who's passed a state licensing exam and participated in continuing education, who has a formal education in infection control and epidemiology, who's educated in mental health and trauma-informed care, and who can legally make a professional health assessment rather than just collect data, as well as assess chronic health conditions and individualized healthcare plans. Our schools each need someone who is professionally trained to assess possible COVID cases and who can train and assist school staff with safe practices for PPE use, cleaning, and other pertinent safety measures. We urge you to pass Bill SB 5004 to ensure that the health standards in our schools are equitable and meet a standard that allows families to send their children back to school knowing that there is a trained professional in their students' building to support the COVID response. Thank you.
Thank you.
Madam Chair, I have a question of the witness.
Senator Edwards, I have one more speaker
Okay.
on 5004, and then I'll come to the committee members. Next speaker, Gloria Jordan on Senate Bill 5004.
Gloria, you can unmute your mic.
Hello, thank you for having me. So I'm speaking on Senate Bill 5004. When we say racism is a public health crisis, we must look at that multidimensionally. Oftentimes, especially in minority communities, the school nurse is both the first person students see for their health and the only person that follows that student's health. School nurses are public health educators and on the front lines of this pandemic. As you know, Virginia leads the country in the prison to preschool pipeline. Both the VEA president and the Virginia Teacher of the Year advocate for more mental health counselors to reduce the use of SROs to intervene in areas that they are simply not trained for. School nurses are trained in mental health and trauma-informed care. We work in collaboration with counselors and psychologists to address the needs of students. It is also documented that over 40% of Americans have mental health issues coming out of COVID. It is imperative that we have school nurses to be able to assess these needs of children. At the very least, school nurses need to be there to work with counselors and mental health advocates to help reduce this preschool to prison pipeline. Our students deserve this. It is also a matter of health equity, as again, school nurses may be the only person that follows student health. I ask of you to please consider the minority community and the most vulnerable amongst us and have a school nurse in every single school. We are coming out of a pandemic, and it is imperative that there is at least one health educator within that school to help train both the teachers and the staff and the students as we try to navigate safely returning back to school. Please vote yes for SB 5004. Thank you.
Thank you very much. Looking over on the second page, there is, in this long list of speakers that are signed up, one more person to speak for Senate Bill 5004, Julianne Condry.
Julianne, you're on. Unmute your mic, please.
Good morning. On behalf of the American College of Nurse Midwives, I'd like to recognize the vital role that school nurses play, and we stand in support.
You're on mic.
Can you hear me now?
Yes, we can hear you.
Yes, I said on behalf of the American College of Nurse Midwives, we'd like to recognize the vital role that school nurses play and stand in support of this bill.
Good morning, Janet. How are you?
Okay, it appears that Julianne has made her statement, and we have a long list of speakers, and I don't have any way to recognize those persons who have their hands raised. So with that understanding, we're going to move to we're going to move to the members of the committee for their questions and remarks, and I'll start with Senator Edwards.
I'd like to ask a question, I guess, of the patron. As I understand from reading this, and I don't have the substitute, but currently the law says schools may have school nurses, et cetera, and now this changed it to shall. Each school shall have a registered nurse. Is that the correct, is that what this bill does? It goes from may to shall?
Senator Higgins?
Madam Chair, that's correct. It requires one certified registered nurse per school building.
Okay. My second question, Madam Chair,
Senator
is
Edwards?
percentage-wise or number-wise, how many now have school nurses of some sort, and how many do not, or however you want to answer it, percentage-wise or whatever? Do you know?
Yeah,
Anybody?
I do know, Madam Chair.
Senator Higgins?
We have approximately 1,800 school buildings in the state of Virginia, and there are currently 1,300 school nurses in place.
Okay, thank you. Madam Chair, third question, is there a cost estimate as to how much this would cost?
Madam Chair.
Senator Higgins?
That's the million-dollar question, literally. There's various funding models out there, and we have requested not just one, but multiple fiscal impact statements and have received a variety of answers as a matter of fact. And the way that one of the funding models has us actually, when we take those school nurses and put one per school building, there is a cost savings that goes along with that because we're spreading the school nurses out thinner. The problem then lies in that some of the larger localities will be not getting the funding they had for school nurses. Now, there's other funding options to be creative. There's talk of using grant money, perhaps some of the federal stimulus money. I would love to work that out with the Finance Committee and speak a little more in detail. But there's lack of transparency and there's a lot of inconsistency as far as how much school nurses cost. Some localities pay them as healthcare professionals, other localities pay them as teachers and time and service and whatnot. So there's not a set price for a school nurse, but the delta is about 500 school nurses that would be needed. So it's either a process of sharing the wealth and taking them again from some of the larger localities, spreading them out, and then having to be a little bit creative with either some volunteer workforce, some grant money. So there's different funding models is what I've received for actually. So So I don't have a concrete, it's going to absolutely cost you this dollar amount, but I think there are ways to do this, and I'd like to take a look at that with the Finance Committee.
Madam Chair, I have another question.
Thank you, Senator Edwards, but I want you to be mindful that we have until
Right.
noon to get through this calendar, and it's quite a number here. And I don't want to spend an hour on each bill, because that will get us only through 4 bills. So one more question, thank you.
Yeah, my final question.
Final question.
Final question is, in the school counselors category, there's a model as to how many school counselors should be in an elementary school, middle school, and a high school. Is there any kind of model like that? How many, for example, a large high school, you'd probably want to have more than one school nurse. On a small elementary school, for example, maybe one nurse would be enough. Has anybody looked at maybe coming up with so many school nurses per student in different categories, elementary, middle, and high school?
Madam Chair, we have looked at that, and that's the ratio model. That is a possibility, and it's not quite as cost effective, but that is an option. We decided against going with the ratio number. It was a little bit easier to spread out just one nurse per school building, but yes, that is another option out there.
Thank you.
Madam Chair.
Thank you, Senator Higgins. Thank you, Senator Edwards. Other members of the committee, Senator Newman.
Madam Chair.
Madam Chair. Madam Chair, I'd like to move the bill be reported. The problem isn't the aspiration of this bill. To me, it's the funding. And I think we're going to have to decide the funding and finance. And right now, we don't have the money for it, right? So we just don't. But I think the aspiration is good. And so I think we can send it to finance. My motion, Madam Chair, would be that we report and we refer to finance.
Okay, there's a motion that the bill be reported and re-referred to finance. Mr. Clerk, would you please call the roll?
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker.
Aye.
Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. I'm sorry. Thank you. Senator Lucas.
Aye. The bill will be reported and re-referred to Senate Finance and Appropriations. Up next is Senate Bill 5020. Patron, Senator Chase.
Thank you, Madam Clerk. Madam Chair, thank you very much. Senate Bill 5020 is an opportunity to help everyday families with their education challenges. As you all know, many localities and school boards have opted to go 100% online due to fears related to COVID, creating a tremendous burden on families and parents of school-aged children, many who are forced to work full-time and now educate their children full-time. This burden is actually felt by every parent, regardless of their socioeconomic status. We're talking about dual income earners who are forced to full-time work and then also full-time hold their children accountable who are supposed to be sitting in front of a TV screen for 8 hours. Where is the accountability there? I also have to think about the financial economic hardship, as many of the parents in my district who I'm talking to are saying that they have to employ other additional resources like tutors and nannies to come alongside them while they work during the day. This causes a special burden on families of single parents, those who are considered essential workers in our healthcare industry, disabled parents. And I go back to who is supervising the kids who are forced to sit in front of a TV. Madam Chair, I would argue that we owe it to the parents here in Virginia who are faced with this incredible burden, not only from a time standpoint, but also from a financial, economic standpoint, of trying to manage both of these roles. And particularly disadvantaged, I would say, would be those who are in areas that may not have access to broadband. I think about those kids. The kids who are especially affected, I think, are the lower income kids and the minority communities. We need to ensure equitable access so that your zip code does not determine the level and the quality of your education. Madam Chair, this bill is it's basically takes the state portion per student. My understanding is that the cost is about $9,000 a year to educate one student in the state of Virginia, and to take the state portion of that and allow that to be used to offset the tremendous financial burden that many families are incurring today whenever these localities or school boards vote to go 100% online. We at the state level, if the localities are, in my opinion, abdicating their constitutional responsibility to educate our kids in a serious way, then I think we at the state level need to provide an alternative for them. And I fully support school choice, especially during a crisis. I think we need to ensure equitable access and make education in Virginia great again. Thank you.
Thank you, Senator Chase. We have 2 speakers signed up to speak in favor of Senate Bill 5020, and the first one in the queue is Kate Groff. Kate Groff.
Hi, I'm here. Hi, my name is Kate Vincent Groff from Glen Allen, Virginia. I am the founder of the Homeschool Association of Virginia, a group of about 1,000 families. Our group has grown by 600 over the past 6 weeks. Our newest members are not veteran homeschool families. They are public school families converting to homeschooling for the first time. The unexpected emergency changes in public schooling has radically affected these families' lives who had no time to plan for schooling at home. I have listened to our newest members share their financial concerns for the sudden need for childcare, technology, internet, curriculum, space for schooling at home, etc. For this reason, on behalf of these members, I am stating my support for this bill, Senate Bill 5020.
Can I call you back in a little while? I'm in 2 meetings right now. Okay.
Thank you, Kate Groff. And the next speaker is Kathy Bircher on Senate Bill 5020. Kathy Bircher.
Good morning, Madam Chair, members of the committee. I am actually representing the Virginia Education Association, Kathy Bircher. I'm actually speaking in opposition, so I wasn't certain if there was someone in the queue to speak in favor that you needed to have go in front of me, or if you wanted me to proceed.
You're the next speaker in queue.
Thank you, Madam Chair, members of the committee. Kathy Bircher with the Virginia Education Association. We are opposed to this legislation. Frankly, what I heard Senator Chase describe as something that the Virginia Education Association has really been working for, particularly during this time of pandemic, which is ensuring a system of high quality, low cost childcare for all families across Virginia, regardless of their ability to be able to afford that. Without question, this pandemic has put extraordinary burdens on parents and families, but also on our public schools. Contrary to many of the words you're hearing, schools are open. Our public schools are educating children. The modality has changed. This is not the time to defund our public schools. And when you look at the content of that bill, the bill proposed by Senator Chase, that is exactly the scheme that is being proposed. We are in a state we are the 10th wealthiest state, according to Congressional Quarterly, in the Commonwealth per capita, and yet state funding for public education ranks 40th in the country. It is time to fully fund our public schools and to ensure that they have the funds necessary to keep our students safe, our families safe, and our community safe. moving funding out of our system of public education simply because a school division has made the choice as a local decision to make set safety standards for their students and staff that make the most sense for that community is absolutely the wrong direction to go. The VEA strongly opposes this legislation.
Thank you for your comments. Those are the only two speakers signed up for Senate Bill 5020. I now turn to members of the committee for any questions or comments.
Madam Chairman.
I want to recognize Senator Donovan.
Thank you, Madam Chairman. I just would like to state that school is more than a curriculum. Curriculum is what we're translating to online education, but we have made profound, extensive investments in schools over the last many years in order to ensure that our children have a safe place to be. 40% of our children qualify for free or reduced lunch. It means their families are already struggling financially to make ends meet in the home. We have a third of our children who are on Medicaid, 200,000 have no broadband in their homes. So I need to point out that if a parent is homeschooling or switching their child to a school that accommodates the multitude of needs that schools provide beyond curriculum, that we are no longer paying their ADM, and we are leaving them potentially in a very difficult financial situation, and that I think in a pandemic, it would be extraordinarily appropriate for the state to help those parents who we have in the past supported make the transition and make the change now as they struggle to have this happen. I don't know how many of you have heard from your constituents, but I particularly will mention one in my district who has a 12-year-old, an 8-year-old, and a 9-year-old. Both parents are essential workers. One is a certified nurse's assistant. One of them works at Lowe's. They have worked the entire time of the pandemic. They have no resources. They don't have family here. The 12-year-old is monitoring the 8 and 9-year-old in the home. The children have some incredible stress and depression related to the schools being closed. They're having trouble getting mental health assistance. These are the crises that our family, this is real. This is real in your district and in mine. And we need to think of every way we can support families having all of the other constructs that school provides beyond the curriculum that's being sent to the home, if they can get it. So I want to point that out because as we look at this legislation, this is a different era of our supporting our children actually getting an education, which, by the way, is the means by which they access economic opportunity in the future. And we know that. We know that health and public health is directly related to education level, and we know that success and wealth is as well. So I just want to make that point. I will be supporting this bill.
Next, committee member, Senator Saslaw.
Are you ready for a motion?
If there are no other speakers, Senator Saslaw, motion is in order.
She said yeah. I move that it be passed by indefinitely.
Madam Chair,
Senator Newman.
just speaking briefly to the motion.
Yes.
Mr. Chairman, Madam Chair, I'm not going to vote for the motion, but the problem right now is the bill is constructed in a way that it really, I think, accidentally hurts rural Virginia. Because right now, the money is sometimes 90% in Southwest Virginia, 10% in Dick Saslaw's area, and the state portion is what's going to be taken away, leaving some of these guys in Southwest Virginia with almost no money to run their schools, while Northern Virginia, with all due respect, is going to have most of their money. So I think we could fix that. The motion kind of bypasses that. I kind of associate myself with Senator Donovan's comments. I think we could find a way to fix this, but we'll see what happens with the motion.
You heard the motion? And a second. Mr. Clerk, would you please call the roll?
Senator Saslaw.
Aye.
Senator Howell. Aye. Senator Newman. No. Senator Locke. Aye. Senator Barker. Aye. Senator Peterson. Aye. Senator Cosgrove. No. Senator Lewis. Aye. Senator Donovan. No. Senator Suderline. No. Senator Peake. No. Senator Edwards. Yeah. Senator Chafin. Senator Hashmi? Senator Lucas?
Aye.
Nine ayes, 6 nays.
The bill will be passed by
Okay.
indefinitely.
Yeah, I don't know why that happened.
Next bill is Senate Bill 5021. Patron, Senator Chase.
Thank you, Madam Chair. This bill is somewhat similar to the last bill that we heard as it relates to our students who are in these home settings, 100% online, attending a mandatory virtual learning environment. And one of the things that I've learned in trying to bring broadband to my district, that there are a lot of communities across Virginia that do not have access to broadband or consistent and reliable internet service. If they are mandated to receive 100% online education, yet they are unable to access efficient and effective broadband or online service, how are they supposed to be educated? This bill makes it mandatory for school boards to elect to provide distance learning education as the mandatory and sole method of education learning, either full or part-time, for any period of an academic year to ensure that each student in the school system shall be provided with technology at no additional cost to every enrolled student in the educational process. And should the virtual learning require connection to the internet, the school board shall provide internet service to each household where virtual learning via internet means is required at no cost to the student or student's family. The bill will decrease a widening education gap. Distance learning will be difficult for a lot of children. Only the ones who want to learn will be studious, while the others will fall farther behind. In classroom, education is the best, but during this pandemic, this bill offers an alternative that will help. Thank you.
Thank you, Senator Chase. There is one speaker in queue for Senate Bill 5021. Can we get Kate Groff on the line to speak in favor of 5021?
Kate, if you don't mute.
Hi. Yes, I am muted. Hi, I'm Kate Vincent again. I'm from Glen Allen, Virginia, and this is just me speaking personally that I am in complete support of this. My past, I'm a retired public school teacher, and I've worked in many different areas, and I can tell you without question, children need access to this technology if they're going virtual, and I know families will need help with this. So please consider that. Thank you.
Thank you. Ms. Groff is the only speaker signed up to speak for Senate Bill 5021. So now I will turn to the committee for any questions or remarks or motion.
Madam Chair,
Senator Edwards.
I love the concept. The trouble is we don't have enough broadband. I don't know how the school boards could make sure that every student has a computer and internet service. I mean, the rural areas don't have broadband in so many, most places. And that's number one, getting broadband. I'm going to vote for the bill, though, to send it to Finance, just to express my support for the concept, although I don't think we have the resources. The broadband is not there, and therefore the school boards can't really do this.
Other speakers from the committee?
Madam Speaker. Ghazala Hashmi.
Senator Hashmi?
Thank you, Madam Speaker. Like Senator Edwards, I support the concept of this bill. It is vitally critical that we enable our students to have access not just to the technology and the learning devices, but also to broadband. That is the critical point here, is that we simply don't have broadband access in many parts of the Commonwealth. And while we have various organizations and the state government working to increase and expand broadband access, I can't support the bill because it mandates that school boards give access to students when that's simply not possible at this present moment.
Thank you, Senator Hashmi. Other members of the committee? Senator Howell.
Thank you, Madam Chair.
I just want to make sure everybody is aware that the governor has included significant funding in his budget for broadband expansion in the Commonwealth. And also point out that local school systems are stressed, and as much as we would like them to be able to be providing computers for every student who needs one, I think that's unrealistic at this point unless we can figure out significant other cuts. Thank you.
Senator Peterson?
Madam Chair, is my mic on? No. Okay. Yes, great. I abstained on the last vote on school nurses, and I'm going to abstain on this vote. I noticed that these are two mutually exclusive. One, we're mandating school nurses in buildings that are currently empty, and now we're going to mandate providing broadband in a remote learning environment that may not exist in 6 months. So, you know, I think that we're putting all these obligations on our budget. We don't know what's going to happen in the next 30, 60, 90 days. It's a mistake to be adding on a bunch of new spending obligations when we're already upside down by $2.7 billion in the biennium. So I like the concept, but again, we can't keep adding new spending priorities and pretending like this is significant if we just don't have the money and we're not willing to raise taxes. And I'm not willing to raise taxes. So the bottom line is I'm going to abstain on this vote also.
Thank you, Senator Peterson. Other members of the committee?
Madam Chairman. Donovan.
Senator Donovan.
Thank you, Madam Chairman.
We have to look so far now to see each other.
Thank you, Madam Chairman and members of the committee. I just want to make a couple of points here. We have a serious health crisis in our state, not to be understated, and it is the health of our children. The American Academy of Pediatrics said essentially, let there be no obstacle to children having schools open so they have a place to go. Because the much greater and profound health risk for our children is to not have the wraparound resources of our schools and a safe place to be. And Senator Peterson is correct. When we say the schools aren't open, that is an issue. We need to open the schools and make sure they have the resources, because there's no more important financial investment we can make than in our children right now. And I cannot emphasize the crises that is unfolding in Virginia because we do not have bricks and mortar. I'm a supporter of virtual education. I've carried it for the last 4 years. I'm a big advocate, and it's a very important, robust curriculum we need to offer kids for whom that is an asset or for whom there is a health risk for them or their families and they need to have it, but not in the absence of also opening bricks and mortar schools for our children. And whatever we do here this week and the next couple of weeks, our emphasis and priorities have to be clear and evident. And the clear and evident health crises in Virginia right now is our children. And we need to be as resourceful and innovative as we can. I agree that the solution of putting this on the school boards is suboptimal, but children, if we're going to force them to be away from school, we better make sure they have a way to get the curriculum when they get nothing else. Thank you, Madam Chairman.
Thank you, Senator Donovan. Other members of the committee? Remarks? Questions? We're open for a motion.
Move to report and re-refer to finance.
Substitute motion to pass by indefinitely.
The substitute motion is to PBI, and there's a second. All in favor? Mr. Clerk, would you please call the roll?
Senator Sadlow.
To pass by definitely aye.
Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson.
Abstain.
Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. Senator Edwards.
No.
Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
9 ayes, 5 nays, 1 abstention.
Thank you, Mr. Clerk. Next bill, 5025, Senator Newman.
Thank you, Madam Chair. Madam Chair, this bill relates to the the activity of the Commissioner of Health and also the board. As most of you know, or you think you know, the Board of Health can come up with emergency regulations, and they have as it relates to COVID. In fact, there is a small section of this code that actually allows the commissioner to operate on their stead for some period of time. My concern is that we currently have a Board of Health that is packed with 15 professionals, but thus far, we've only had the commissioner taking all the actions. This bill basically would say that the commissioner can act for 30 days on an emergency regulation. Then after that, the board needs to get together and they may act for up to 18 months, which is the time of the Administrative Process Act. Madam Chair, to be honest with you, I understand that His Excellency the Governor indicated to our office last night they're opposed to this. I don't know why. Because I think this still allows the board, who is supposed to be vested with this authority to take these emergency actions, it does limit it to 18 months. So, Madam Chair, that's what the bill does. I think it's better to have the entire board operating. The board has met on June 4th, but they didn't take any action and did not take up these considerations. So I think this makes a lot more sense. I would hope that we would consider the bill, Madam Chair.
Thank you, Senator Newman. And as I look on both pages of this docket, I do not see that there is a speaker signed up. On which page?
I don't see the problem. How they can meet virtually if they have to.
This allows them to meet virtually. It's just the governor doesn't want them to do it.
Uh-oh, what happened?
I don't see a problem with it.
They signed up for all, they're the ones that signed up for all the bills.
Okay, so it's the Department of...
It's Oliver, M. Norman Oliver.
Oh, and now it's working.
It's here. They're the ones that signed up for all these, but they're trying to.
We were here 1 hour, we've done 4 bills. After Steve's bill, that'll be 4 bills in 1 hour. We got 20 bills. So about 5, yeah, and that doesn't include the ones that are getting referred. So that's 5 hours at that rate, just on today's.
Okay, I don't have it on my list, but you have an email, so we will call on the Department of Health, Dr. Oliver. I've got 5026 for Dr. Oliver, but not 5025.
They have.
Oh, Jesus, let's just vote.
Madam Chair, can you hear me?
I can hear you, Dr. Oliver, and I understand you sent an email in, so
Yes,
I'm
I
sorry.
did.
I have you on a number of other bills, but go ahead on 5025, please. Thank you.
Well, thank you. Thank you very much, Madam Chair and members of the committee. I'd like to say that the administration strongly opposes this bill. The COVID-19 pandemic has been an unprecedented and very rapidly evolving emergency situation for the Commonwealth. The response to the pandemic has demanded rapid and efficient decision-making. The existing provisions of the Code of Virginia in 32.1-13 and 32.1-20 have long supported the Commonwealth in its ability to make timely, efficient, and effective policy decisions on a wide range of issues to promote public health and safety. It is important to the Commissioner and to the Board of Health to retain the ability to quickly respond to and to prevent the spread of communicable, contagious, and infectious disease. This bill adds additional steps to the current process and decision-making, and therefore would mean that it would take longer, making it more difficult for the Commonwealth to make decisions in a timely way. It would take us, it would mean that the pandemic, for example, and many other issues that would not be dealt with in a timely manner. This legislation would significantly hamper the Commonwealth's ability to address dangers to the life and health of Virginians. Thank you, Madam Chair.
Thank you, Dr. Oliver.
Madam Chair.
Senator Newman?
Just as response, Dr. Oliver is a brilliant physician and brilliant man. But on this, he's just wrong. I mean, this gives you 30 days to do whatever you want, and then you bring the board in. So in no way does this slow down the process, and it allows that order by the board to continue for 18 months, which is the administrative process area. So that's the reason we brought the bill.
Thank you, Senator Newman. Are there any questions of the patron? If not, a motion is in order.
Second.
It's been moved and properly second that Senate Bill 5025 be reported. Mr. Clerk, call the roll.
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove.
Aye.
Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
11 ayes, 3 nays, 1 abstention.
Bill is reported.
Thanks.
Senator Newman, you have Senate Bill 5028.
Yes, Madam Chair, I do. And on the last bill, I'll be glad to work with Dr. Oliver, who's an honorable guy, if he needs some adjustments. Madam Chair, this bill is a bill that I have, and I think that Senator Barker has.
Senator Newman, your mic.
Oh, sorry.
Thank you.
Madam Chair, I'm sorry. Madam Chair, this bill is similar to one that has been introduced also by Senator Barker, and then there's also one by Senator Suderline, and then there's also one that Senator Donovan has that is adjunct to it. Madam Chair, you may want to take them up all together. I have no pride of authorship. I'll just tell you what my bill does, and then maybe Senator Barker can explain the additions to his, and that may move your schedule along more quickly. Madam Chair, as you know, we sit here today and 90% of all deaths have been by seniors of COVID, 90%. The majority of those deaths have been in long-term care facilities. The most vulnerable population, about 60% of the deaths have been in one of those facilities. Madam Chair, I think the administration and the governor's office found early on that there is a code problem as it relates to reporting of information in nursing homes, and the governor's office had indicated by their press conferences that there needed to be changed through the Code of Virginia. The CDC has come out since then and said that it is important that this transparency as it relates to nursing home outbreaks be made available. And as a result, I'm very pleased to see that the governor has taken some actions that are helpful on this, but I think the Code of Virginia needs to make sure that, that this information is available. If you have a senior and they're in a nursing home or a long-term care facility and there is a major outbreak, the parents and the children of that individual need to know. Madam Chair, this bill extends basically to the items I've discussed. As you know, we do have a couple of other bills, and it's up to the chair, but Senator Barker has 5081, and Senator Suderline also has a bill, which is 5105, that could, Madam Chair, with your permission, be taken up together.
If the other patrons have no.
Madam Chair.
Okay, are the other patrons willing to have their bills all taken up together? Senator Barker?
Yes, I think they should be taken up together. That's
Okay,
fine.
all right.
Madam Chair, Senator Suderline here. That's agreeable to me as well.
Thank you. Thank you very much. Okay, we have speakers signed up to speak to Senate Bill 5028. And the first speaker is going to be Kathy Burcher.
Kathy Burcher, you can unmute your mic.
Kathy Birch with the Virginia Education Association. I wanted to make sure 5028 had to do with public and private schools, not nursing homes. So that's the bill that I wanted to speak to.
Madam Chair,
26.
Madam
Can you
Chair.
hear me now?
I'm sorry.
Sorry. Senator Newman.
I think if Senator Barker and I have talked, and David and Senator Suderline and I think there's a way through this. If you have Senator Barker talk about the additions and then Bill, we've agreed on how this can kind of move forward.
Madam Chair?
Yes, Senator Barker.
Yes, mine is Senate Bill 5081, and the relevant section here in my bill, which is only a 2-paragraph bill, deals with reporting entity. And it says reporting entity means a medical care facility, residential or day program, service or facility licensed or operated by any agency of the Commonwealth, school or summer camp required to report an outbreak of a communicable disease pursuant to 32.1-37. So that's the language that would be there. What it would do is to capture the types of things that have been, where there have been identifications of outbreaks in the past. And so I think this would, I think this language would be comprehensive and provide opportunity to make sure that everybody has relevant information there.
Thank you, Senator Barker. Senator Suderline?
Yes, Madam Chair, thank you. My bill, Senate Bill 105, it comes from the exact same place. It's also a short bill. It requires the department to make, which would of course be VDH, to make available the information on a website, any information regarding outbreaks of any communicable disease that would be required by the board to be reported at nursing homes in the Commonwealth. And that information would include the name of the nursing home where the outbreak occurred, the total number of confirmed cases of that communicable disease, and the total number of cases, both of the staff and of the individual residents. Also, it seeks to clarify in the next code section that nothing shall prohibit the release of information about outbreaks of a communicable disease at nursing homes in the Commonwealth.
Thank you, Senator Suderline. We have one speaker signed up to speak on Senate Bill 5026, and that's Amy Siebert.
Amy Siebert, you can unmute your mic.
It's unmuted. Can you hear me?
We can hear you.
Okay, great. Good morning, Madam Chair, members of the committee. This is Amy Perrin-Seibert. I am here today to testify in support of Senator Barker's bill, as well as Senator Newman and Senator Suderline's bill. We believe that Senator Barker's bill is the broader bill that would encompass Senator Newman and Senator Suderline's. We think it's really important that all the reporting entities that currently have to report stay the same, but that Virginia VDH will have to now report the name of those entities as well as how many active cases and deaths there are. We think it's critically important to public health and for everybody to know where those outbreaks occur. And as Senator Newman said, we do believe that the code has been very confusing on this and it needs to be clarified. So we would support Senator Barker's bill, Senate Bill 5081, because that's the one that is broader and would encompass both of those other bills, includes nursing homes as well as all the other facilities. So the Virginia Press Association supports that, who I'm speaking on behalf of, as well as the Virginia Coalition for Open Government. Thank you.
Thank you so much. We also have signed up to speak on Senate Bill 5026, and I guess that would be on the three bills together, and that's Dr. Norman Oliver.
I'd like to pass on this. I believe that, as Ms. Siebert just said, that Senator Barker's bill 5081 as a broader bill would encompass the other bills, and the administration strongly supports 5081.
Thank you, Dr. Oliver.
Madam Chair.
Senator Newman?
Madam Chair, I would move that my bill and Senator Suderline's bill, which would be 5026 and 5150 be rolled into Senator Barker's bill using the Barker broader language in Senate Bill 5081.
Yes.
And that we remain co-chief patrons and all co-patrons are retained. So I would move that we roll them together. Madam
Okay,
Chair.
it's been moved.
I'll second that
Second, that the bills
motion.
be rolled together into 5081. All in favor, Mr. Clerk, call the roll. Okay, fine. Voice vote, whatever. All right, thank you. Okay, now we need a motion on 5081.
Madam Chair, I move to be reported.
It's been moved and properly second that Senate Bill 5081 be reported. Mr. Clerk, call the roll.
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson.
285028. Okay.
Senator Cosgrove.
Aye.
Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. I'm sorry, Senator Peake. Thank you. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
Ayes 15, no 0.
Yay. Thank you. Next bill is, at the request of the patron, 5028, will pass by temporarily. And we will move now to 5042. Senator Kiggins.
Madam Chair, speaking to Senate Bill 5042, this bill is a bill to require nursing facilities or long-term care facilities to plan for visits for their residents at a minimum of once per week unless waived by the resident or family. The reason behind this bill is that we have closed our nursing facilities as of March, and Senator Newman spoke to it briefly, but when we watched on a daily basis the disaster that transpired behind those closed doors, killing our most vulnerable Virginians. So we watched as days turned into weeks and weeks turned into months. And we started to receive phone calls from family members and caregivers who are such a vitally important part of our caregiving team in nursing facilities. This is a group of people who is already isolated and who is lonely and deals with this on a daily basis. So the families that were then shut out of our nursing homes, they do things that are important to our patients. They feed our patients, they change our patients, they put hearing aids in and dentures in, they make sure call bells are in place. They're part of the caregiving team. Many facilities have done a wonderful job since then, since we have kind of watched the disease progress, and they have taken on just different creative ways to allow for family members to visit through windows and do drive-by parades and letter writing campaigns and setting up plexiglass boxes similar to what we have here. So many facilities have done a great job, but there are many facilities that have not. And these are the ones that we're hoping to address with this bill. We've heard from caregivers and family members whose family member or loved one has lost weight. They see them lose weight. They see them in the same clothes day after day when they are allowed to have any type of contact or visitation. We see that they have lost eye contact. They don't smile anymore. There's a Harvard Medical School study of 2009 that states that if a patient or a resident has 1 to 7 hours a week of visitation with a family or friend, they have less pain, less pressure ulcers, less shortness of breath, increased immunity, less hospitalization. So it's not just the physical health of our patients that we are now becoming concerned about, but also their mental health for not only the patient, but for the caregiver and family who has suffered just an amazing amount of what's turned into depression and anxiety. And we're not forcing our facilities to have in-person visits. This is a bill that requires either virtual or socially distant inpatient visit. There are ways to do it, and there are ways to do it safely. The purpose behind this bill is ensuring that these patients are no longer isolated and are no longer lonely. We're killing our greatest generation, not from COVID, but from isolation and loneliness. This is a humane bill that speaks to the quality of life of our patients and residents. We didn't ask them what their opinion was when we put all of these safety precautions in place, but I would bet if we did, and they know that their days are numbered, and this is the last place that they may ever live, but I bet if we asked them, it would probably even be worth, the risk just to hold a hand or to receive one last hug. So it's time to give a voice to our voiceless. This bill is a first step towards complete reunion and the end to involuntary confinement that we've condemned onto our older adults. Access to family and loved ones is an important part of every resident's health and well-being, And this move is in the right direction for some of our most fragile Virginians, and I highly suggest that you support this bill. I think there's people to speak to it as well.
Thank you, Senator Kiggins. We have speakers signed up, and the first person to speak in favor of 5042 is Christina Holloway.
Can you hear me?
Yes, very well, thank you.
Great. Good morning. My name is Christina Holloway, and I would like to thank you for allowing me to speak today on behalf of SB 5042 and our elderly population who is unable to speak here for themselves. I'm a nurse practitioner currently working in long-term care facilities and providing care for our elderly population and have done so since 2005. Unfortunately, we forget that simply caring can be most impactful on health, the simplest of care that only family and loved ones can provide. I have observed firsthand that a lack of family interaction leaves patients feeling deserted and confused why their families aren't coming anymore. They stop eating and drinking, others refuse medications, yet they will light up when they hear a loved one's voice. Interaction with family provides positive psychosocial outcomes and alleviates fears of abandonment. Additionally, families contribute to the continuity of care as they are often the first to notice changes in their loved one's health during visits. I have witnessed this daily, and I lived with this with my own mother when she was in a nursing home. This is a horrendous time, but especially difficult for long-term care residents and their families. Unfortunately, COVID is here, but not from family or patients. Research shows long-term care breakouts are usually the result of staff. So the reason we have separated families in the first place is not a valid reason to keep them apart. While properly executed in-person visits are feasible, there is no reason to not at least support window visits or virtual visits. There is little or no cost, and don't let anyone tell you any differently. It costs nothing to wheel a patient up to a window. Tools such as a tablet or laptops for virtual visits are low cost and already available in most facilities. Staff is available. Every facility has staff activity coordinators who can facilitate these visits, especially since most activities and group outings have been canceled. Without mandating these visits, the families and patient fears become reality. Sadly, I have consoled families who never got to say one last goodbye. This bill is necessary and humane. Most importantly, it shows that we care. Please vote in favor of SB 5042 to show that you care too. Thank you.
Thank you. We have quite a situation with timing here. We have 1, 2, 3, 4, 5, 6 more speakers on Senate Bill 5042. It is now 11:16. We have enough bills to last us until 4 o'clock this afternoon. And so we need to speed this up, otherwise some of these bills are not going to get heard before session. So as we call on the other speakers, I would appreciate it if the speakers would keep their remarks to 2 minutes. We're going to want to run far over the time that we have allotted for these bills this morning. Next speaker, Deanna Klein, speaking to Senate Bill 5042.
Deanna, you can unmute your mic.
Good morning. Can you hear me?
Yes.
Good morning. My name is Deanna Klein. I'm a geriatric nurse practitioner in Virginia Beach, and I work intermittently in long-term care facilities, hospices, and primary care office. Thank you for hearing my thoughts today. I wanted to open with the June 23rd statement from Tara Ragland, the director of the Division of the Licensing Programs, who stated in her letter that day that we know that the ongoing separation from family and friends has created feelings of isolation, anxiety, and depression for many residents throughout our state. I would add that the anxiety and depression are not just feelings. In so very many cases, they have become actual diagnosis, or they have exacerbated because of the restrictions placed on the residents by the facilities. Immediately after restrictions, we have several patients who have, as Ms. Kiggins said, lost weight, who have had declines in mental status, who are extremely depressed, anxious, even hallucinating from severe isolation. Imagine eating every meal by yourself for 4 to 5 months because the patients are not permitted to have visitors and staff members, therapists, even speech therapists and occupational therapists reporting that patients having reduced mental status, increased difficulty swallowing, and reduced food intake. Staff members are bringing trays in, they eat alone, they're not even staying long enough to open containers or prepare trays or cut food, and therefore patients are suffering physically that way as well. I have even been asked to consider sedation medication, so patients will not be tempted to venture into the hallway, that the staff is tired of asking them to, or forcing them to stay in their room, and patients are wanting some to get out of their four walls. Of course, I did not do that. Rather, I have asked that that the residents be permitted normal human psychosocial interaction with one person, one family member or friend designated, and that has been declined on an ongoing basis. And then I've had families complaining to me that because the sedation was not done, that the facility has requested that they change providers to the facility provider rather than the primary care provider that they have known for decades. So they are being coerced and pressured. I would venture to say in this current environment that patients' rights and families' rights as outlined in the rights of nursing home residents, the federal and state levels have
Ms. Klein, I'm
been...
sorry I have to cut you off because I'm going to have to just let the other speakers just say that they're in favor. We are seriously out of time, and so
Okay.
I thank you for your remarks. And as I motion to the clerk, I would have you just bring up each of the next speakers on 5042 and have them express their disposition on the bill. And I think the ones that I have here are all in favor, but I'll call them up so that we can see them anyway. Deanna, thank you so much. Can you bring up Deborah Buchanan, 5042? Eleanor Junat? How many other people there? Eleanor?
Eleanor, you can unmute your mic.
Eleanor? Eleanor is in favor. Can we go to Laura Duvall?
Laura, you can unmute your mic.
Laura Duvall is in favor.
Yes, good morning.
Eleanor, you're in favor of Senate Bill 5042. Mr. Clerk, I'm just going to call the other names. Laura Duvall is in favor of the bill. Susan Hines is recorded as being in favor of 5042. Patricia, I think that's Vannucci, Vannucchi, is in favor of Senate Bill 5042. Any remarks by members of the committee on 5042?
Madam Chairman.
Senator Cosgrove.
Question for the patron.
Senator Kiggins?
Madam Chair.
Thank you, Madam Chairman. I'd ask the patron, I'm a little concerned about the in-person portion of this particular bill. In reading the language of the bill, I'm not sure who gets to choose whether it's virtual or in person. We know that our nursing homes have had the worst time with the COVID-19 epidemic or pandemic. And I just have a little angst about requiring that there can be in-person visitation. Can she alleviate my fears on that?
Madam Chair, yes, I'd like to. This would be following CDC guidelines as well as facility guidelines to implement socially distant in person. It does not say in person, face to face, so socially distant, following the guidelines that are currently in place.
Senator Cosgrove?
Well, I thank the gentlelady.
Thank you. I have one other person who signed up to speak, Dr. Noam Oliver, on 5042. And if Dr. Oliver is in favor, we need to move the agenda along.
I believe that's an error, Madam Chair. I was not planning on speaking on this bill.
Thank you. Back to the committee. Any questions by members of the committee? It's been moved and properly second that Senate Bill 5042 be reported. All in favor, Mr. Clerk, please call the roll.
Senator Saslow, Senator Howe, Senator Newman, Senator Locke, Senator Barker, Senator Peterson, Senator Cosgrove, Senator Lewis, Senator Donovan, Senator Sugarline,
Yes.
Senator Peake, Senator Edwards, Senator Chafin, Senator Hashmi, Senator Lucas.
Aye.
14 ayes, 0 nays, 1 abstention.
Thank you. Next bill, 5064, Senator Lewis.
Madam Chair.
Senator Lewis.
Madam Chair, I'm going to lighten our load here a little bit this morning. Madam Chair, this bill came about as some concerns about some notice requirements after a industrial congregate setting, a couple of outbreaks in my district. I understand that the new regs promoted by the Department of Labor may actually address some of these concerns. And so with that, Madam Chair, I would ask if this is appropriate, if it go by for the day.
It's been moved and second that Senate Bill 5064 go by for the day. Mr. Clerk, we're good. Thank you, Senator Lewis. Senate Bill 5068, Senator Peake.
Yes, ma'am, Madam Chair.
Would you like to do the same?
Ma'am?
I'm sorry, Senator Peake.
Yes, ma'am. Madam Chair, I'm to speak on the bill. This bill addresses the mandatory fire drills, shooter drills, active drills, tornadoes, weather, all the kind of drills that our schools have to do on a regular basis. The problem is now, and this is running through the fall, that many of these schools are going to be meeting 1 or 2 days at best, or some students will meet 1 day in person, and that'll be it. And so if that happens to fall on the day that they're there, first of all, they would not get, some students won't get the drill, but instead of learning on the 1 day that they're there, they'll be going through some kind of a safety drill. So this bill leaves it up to the school boards, at least for the next semester, and then we can address it again when we come back in January of 2021. But this gives them, for the fall semester, the ability to skip these drills, considering that many of the students won't even be there, and the ones that are there might only be there for that 1 day that they end up having a drill.
Thank you, Senator Peake. Senator Peake, I think you have one person signed up to speak in favor of Senate Bill 508.
But she's a good one.
I beg pardon?
But she's a good one.
Okay. No, this is Thomas Smith. Signed up to speak in favor.
Thomas Smith, you can unmute your mic.
Thomas Smith? Well, Thomas Smith is signed up to speak in favor of the bill, so I'm going to turn to the committee for any questions.
Madam Chair?
Second.
This is Tom Smith with the Superintendent's Association, and I just wanted to say, for the reasons stated, we're in support of the bill.
Thank you so much, Mr. Smith. I appreciate that very much. It has been moved and seconded that the bill be reported. Mr. Clerk?
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove.
Aye.
Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas. You go. Ayes 15, no 0.
Thank you. Senate Bill 5068 is reported. 5069, Senator Ruff.
Thank you, Madam Chairman. As most of our school superintendents are focused on whether they're going to take schools virtual or part virtual or whatever, one of my superintendents realized that we are going to be in a dilemma on our number of students that are expected to come back. There will be students that will leave the system this year to go to private schools, to be homeschooled. The following year, most of them will probably come back to the public system. Those budgets have to be started in the first of the year to build their budgets. And if they are using the lower numbers, they're going to be skewed. So what this does is just creates, as of March 31st of any school year, if there's a statewide declared emergency, then you would average the 2 years, so at least it would soften the blow on their local budget and their planning. I don't have anybody to speak, but I did get a communication from the Virginia Association of Counties that they were in support of this.
Thank you, Senator Ruff. Any comments by members of the committee?
Move to report, Madam Chair.
It's been moved.
Madam Chair, I think it
Senator
needs to
Howell?
go. I believe it needs to go to Finance.
It's been moved and that the bill, do I get a second? That the bill be reported and be referred to Finance? Second, it's been moved and seconded that the bill be reported and referred to Finance. Mr. Clerk?
Senator Saslow. Senator Howell. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. And Senator Lucas.
Aye.
Ayes 15, no 0.
Bill is reported and will be referred to Finance. Senate Bill 5070, Senator Kiggins, you're busy today.
Thank you, Madam Chair.
Yes, ma'am.
This is a bill that concerns the Independent Practice Authority for Nurse Practitioner. It changes exactly 2 words in the existing bill with the year requirement going from 5 to 2. This bill is a direct result of direct action by the administration, Executive Order 57, which was signed April 17th and expires on September 20th. The NPs, as many of you know, nurse practitioners, we provide safe and patient-centered care, and we fill provider shortages, especially in rural areas and in areas like long-term care. The reason behind the executive order that the governor mandated in April was so that nurse practitioners could fill this care gap. He understands that we provide quality care and we do it safely and have been doing this for years. This body granted independent practice authority to nurse practitioners several years ago. There's 11 states in the union that require some sort of year experience, and Virginia has the longest. Most states out there are 1 to 3 years. So the 5-year timeline is something that is up for debate. We provided a shortage during this crisis, and it was the right thing to do, so we need to continue that. There are now nurse practitioners who are practicing independently in places where there are provider shortages, so to have to renege on that and to say, well, now you've got to go from 2 years back to 5 years. A lot of their supervising physicians have been furloughed, as we've seen has happened to some providers. So we need to be consistent in what we're allowing nurse practitioners to do. We provide cost-effective care, especially in primary care areas. Nurse practitioners are in place already, so we need to keep them there. Currently, The Independent Practice Authority for Nurse Practitioners is a voluntary program, so not all nurse practitioners choose this. There's approximately 8,000 nurse practitioners in the state of Virginia. There's 4,000 that have greater than 5 years of experience, but only 1,000 have applied so far for Independent Practice Authority. It does not change our scope of where we would practice. A pediatric nurse practitioner would continue to practice that field, geriatrics, et cetera, but it only allows us to continue to be able to practice authority again in congruence with Executive Order 57. I urge you to vote in favor of Senate Bill 5070 and granting this independent practice authority to nurse practitioners is viewed as safe, effective, and quality care by our physician governor and should remain in place. Thank you very much.
Thank you, Senator Kiggins. We have 5 speakers on 5070, and so if they're in queue, I'd like to give each one of them just a brief moment to express their either opposition or in favor to this bill. And the first person is Richard Grossman on 5070. Mr. Grossman.
Yeah, thank you, Senator Lucas. In respect of your time, I will defer my comments to the VCMP President, Becky Compton, who's on this call.
Thank you very much. Next speaker, Rebecca Compton on 5070.
Sorry, can you hear me now?
Yes, we can hear you.
Excellent, thank you. My name is Rebecca Compton, and I'm the president of the Virginia Council of Nurse Practitioners and a practicing family nurse practitioner. Thank you so much for the opportunity to present our opportunity of SB 57, supporting the continuation and the permanency of the Executive Order 57 that was put into place by our governor early in April of this year in the setting of the pandemic, which has so greatly affected our healthcare systems. I would like to say thank you to our governor for enacting Executive Order 57 that permitted MPs with at least 2 years of practice to practice autonomously. This led to improving the mobility of providers specifically for nurse practitioners and allowed them to volunteer and provide ongoing continuity of care in the wake of various furloughs and clinic closures that have unfortunately occurred due to the pandemic. However, despite this executive order, many employers have not been able to enact the benefits of this executive order as they are unsure of the length of time this change will be in place and fear unnecessary administrative burden to either enact this change or be in the position to need to revoke this change when that order comes to an end. To that end, it is of utmost importance that we ensure this change remains in effect and becomes permanent. Making this change now will allow it easier for employers to act now and ensure sustainability of continuity of care and access. It will also allow nurse practitioners to identify ongoing opportunities to enhance access to care across the Commonwealth in light of both the pandemic and provider shortages that we are facing. At this point, we have heard no concerns of harm related to this change and don't expect to hear of harm as this supports MPs practicing within their scope of practice. In fact, reducing the time to autonomous practice for nurse practitioners puts us in alignment with other states who require transition to practice. Enacting this change is the right thing to do for our citizens to ensure ongoing access to care, and I appreciate everyone's support of this bill. I certainly also appreciate the faith that the governor has already demonstrated towards the NPs in the Commonwealth, and I look forward to our ongoing partnership to ensure health care access for all citizens in Virginia. Thank you.
Thank you. Next speaker, David Brown.
Madam Chair, I have no comments.
Thank you. Next speaker, Richard Seuss. Is Richard on the line?
Yes, good morning.
Good morning.
I'm Dr. Richard Such, the former president of the Medical Society of Virginia, and I'm honored to be with the members of this committee today virtually to offer comment on Senator Kiggins' SB 5070. The Medical Society of Virginia opposes reducing the 5-year requirement for full-time clinical experience that a nurse practitioner must have for autonomous practice, and opposes removing nurse practitioners from the collaborative practice and team-based care model that provides the safest quality health care for all Virginians. We believe that patients are best served and kept safe by healthcare providers who have the appropriate combination of education and real-life clinical experience. The 5-year requirement is not arbitrary. It is based upon the fact that physicians have a minimum of 10,000 hours of supervised clinical experience in their internship and residency before they are able to practice alone. If nurse practitioners are going to practice independently, they should not have less. The current law ensures patient safety by requiring the appropriate mix of education and practice setting training. Patients deserve to be assured that healthcare providers that practice autonomously have the requisite experience to provide safe, high-quality care, especially in treating complex, chronically ill patients or in the case of an emergency. When any medical provider proposes practicing medicine outside the scope of their education and training, patients are at risk. This proposed change subject Virginia's most vulnerable patient populations.
Yes, well, I don't know what I have a question for the witness. I don't know when the appropriate time is.
Yes, as soon as I get through the next speaker.
I'm sorry, now?
No, well, as soon as this speaker is done, I have one other speaker in queue. Thank you.
Thank you.
Oh, you want to ask this speaker a question?
Yeah, I want to ask this witness questions.
Okay, I want you to go on and do that now because we have 11 more bills.
Right.
It is now 20 of 12.
Okay.
And I don't know how we get through 11 bills in 20 minutes. Quick question, please.
Yes. This bill has 2 years of practice for the nurse practitioner. The bill that the Medical Society of Virginia endorsed to allow nurse practitioners to perform abortions, how much training was required in that bill that the MSV supported?
Dr. Seuss?
Can you please unmute yourself?
Hello?
I'm sorry, someone muted me. I do not know the answer to that.
0 is the answer to that. And so we need 5 years to treat people with mental illnesses, but 0 training to perform abortions. Is that the Medical Society of Virginia's position?
No.
Thank you. Thank you, Dr. Seuss. I'd like to move on to the next speaker. We have one more speaker in queue. We have Julianne Condrey.
Good morning. In light of time, I'll keep my comments brief. On behalf of the American College of Nurse Midwives, we support this bill because Virginia's practice restrictions do impede a nurse practitioner's mobility and ability to provide care where it's most needed. So we support this bill.
Thank you so very much for that brief comment. Any questions from any member of the committee? Motion is in order. On Senate Bill 5070. Senator Keegan.
Madam Chairman, I'm sorry. This is Senator Donovan. May I just make one comment? I promise I'll be brief.
Thank you. I would appreciate it.
I just want to point out that we heard from the patron today that of the 4,000 nurse practitioners that are eligible for independent practice based on the well thought out bill that I supported last session for independent practice for nurse practitioners, have only 1,000 have stepped forward. We have an assessment of primary care. The governor has a primary care task force that is working at this time that has assessed adequacy of primary care provision in the state of Virginia as it is. I think this is there's room here for a grandfather clause. I think there's room here for us to talk about how we go forward, but we haven't even implemented the 5-year bill yet. And so I would encourage that this is not a bill we need to pass in the special session, but it's something that we can have a conversation about based on data and based on good evidence going forward and based on the report from the governor's primary care work group. Thank you, Madam Chairman.
Madam
Thank
Chair.
you very much. Senator Peterson, I heard your voice.
Thank you, Madam Chair. I'm going to agree with Senator Donovan. This may well be a meritorious bill, but I don't think it needs to be in this special session. I think we need to be very focused on what we're doing, and so I would move to pass this bill by indefinitely, and hopefully we can take it back up in January.
It's been moved and seconded that the bill be passed by indefinite. Mr. Kirk.
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suerlein.
No.
Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
Senator Barker. 11 ayes, 4 nays.
Thank you. The bill is passed by indefinitely. Senate Bill 5080, Senator Barker.
Yes, Madam Chair, Senate Bill 580, and Senator Donovan has a companion bill, the Senate Bill 5087. Those two could be rolled together. There are 4 amendments. The Medical Society of Virginia is taking the lead in working with stakeholders on this, and they have 4 amendments. Sarah Stanton of Legislative Services has those 4 amendments drafted, but she's not here, so I don't have the specific language on those. What I will do is tell you what's in those, and then we can figure out sort of how to proceed from there. What it does is it,
Madam Chair.
Senator Donovan.
I think that the clerk is going to speak, but I think they align Senator Barker's bill pretty much with the language of mine. And I think if the clerk can let us know, I heard her on the line, that may limit the number of amendments we need to discuss.
okay.
Madam Chair, this is Anna Moyer from DLS. I have 4 amendments. One of them we received earlier, so that'll be available on LIS, and the other 3, if voted on, would be made available after. Would you like me to go ahead and read them out? Yes. Okay. So,
Madam Chairman.
Yes.
Anna, this is Senator Donovan. Do they basically align with my bill, or do you need to amend both bills to get them where you want them?
Senator Donovan, they do align with your bill.
So maybe we could consider that without having to read through all the amendments, if that's amenable to Senator Barker.
Certainly.
Okay, could someone please move the amendments? Been moved? Second? The amendments will be agreed to. Senator Barker? I'm looking for your speakers so that I can call their names, because we're really not going to have enough time to deal with all of the speakers, but I'll just call up the names of those who are in favor of 5080. Mark Hickman, in favor. Clarence Williams, in favor. Hunter Jameson, in favor. Julie Blavant, in favor. Dr. Catherine Wigberly, in favor. Scott Johnson, in favor. Robert Rawlings, in favor. I'm sorry, went too far. Stopping at Dr. Catherine Wigberly, in favor. Senator Barker, you want to have any closing remarks? And then I'll entertain a motion.
Well, this will help move things forward in terms of telehealth. It's been a tremendous asset to have the expansions of telehealth during the pandemic here. It's allowed a number of people to be able to get medical care that they need without having to deal with putting themselves at risk in different situations. And I think it's a very positive thing that we need to continue to move forward on.
Thank you, Senator Barker.
Madam Chairman.
Senator Donovan.
To improve efficiency, I would move that now that our bills are aligned, that we roll them together and keep 2 chief patrons. And I would concur with Senator Barker's assessment. It is basically ensuring some security of telemedicine as we go forward, because it's such a vital component of reaching individuals and giving them access to health care, but also protecting that quality of health care in
Senator
Virginia.
Donovan, is that a motion?
Yes, I move that we roll them together.
Second. And it's been seconded by Senator Newman. Mr. Clerk? Thank you. Yes, all those in favor, please say aye.
Aye.
Move to report.
Second.
It's been moved and seconded that the bill be reported. Mr. Clerk?
Senator Seslow. Senator Howell. Senator Newman. Senator Locke. Senator Barker.
Aye.
Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
Ayes 15, no zero.
Thank you, Mr. Clerk. Next bill, we've already dealt with 5081, so we're going to go right now to 5083. Senator McClellan and Senator Hashmi. Senator McClellan, you want to start first? 5083. Senator McClellan, I can't hear you. Your mic's not on. Can't hear you.
She's moving.
I had to find another mic. Mine's not working. Can you hear me now?
Thank you.
Thank you. All right. Senate Bill 5083 would require that the new instruction plan, let me back up. The governor has ordered that all public schools in the Commonwealth have to provide a plan to the Department of Education outlining the provision of new instruction to students for the 2020-21 academic year. An order from the Public Health Department requires the schools to also submit to the Department of Ed a plan outlining their strategies for mitigating the public health risks of COVID. This bill requires that the school divisions also post those plans on their website so that teachers, parents, and the public can see those plans and not have to go to the Department of Education to request them. That's the bill.
Thank you, Senator McClellan. Senator McClellan, I'm looking at my list and I don't see that you have any speakers signed up. Senator McClellan.
I understand that Kathy Bircher from the VEA wanted to speak on this, in support of this bill. If she's not on, I'll just say that the VEA supports this bill.
Madam Chairman, move to report.
That Senate Bill 5083 be reported. Mr. Clerk.
Senator Saslaw. Senator Howell. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Lewis. All right. Senator Donovan. Yes. Senator Suderline. Yes. Senator Peake. Yes. Senator Edwards. Yes. Senator Chafin. Yes. Senator Hashmi. Senator Lucas.
Aye.
Ayes 14, no zero.
Senator Donovan, we have the next bill is 5090. Did we deal with that?
Madam Chairman, I will be brief, and if there are questions, I will embellish. This bill basically directs the Department of Health to report new cases in a different way. We need to, when we look at data for the COVID health crises, part of the problem has been that the data is uninterpretable to the general public, and it is causing enormous anxiety, and people have a hard time understanding how we can make the next decision to go forward. And if we report the data in a different way, we're going to be able to alleviate a lot of that and empower a lot of people to feel like they understand what's happening. The proposal in this bill is to differentiate new cases separately. One would be for those that are in communal living circumstances, and there is an amendment for this bill that includes assisted living, I will mention, as listed entities. But communal living cases would be reported separately. They have a different risk associated with those localities. Yeah. The general community would be reported as a separate entity as you break down on the demographics, and that would be attributed by age, because we all know that there's an age-related risk of acuity to getting this virus. The final piece of this bill directs the commissioner to report benchmarks that the public can follow. For instance, a vastly recognized benchmark is if your percent positive is below 5%, you are ready to move forward with the next phase of progress. That is the bill, Madam Chairman, and it is supported by the Virginia Poverty Law Center. Let's see if I'm in the correct area. It's also supported by a multitude of other entities that are in the public health sector, and I'll leave that be.
Thank you, Senator Donovan. Any questions of the Speaker? Of the patron?
Madam Chair.
Senator Newman.
If there's no opposition, this is just transparency that I think we need. I would move to report the bill.
Thank you so much. Is there a second?
Madam Chair,
Yes.
this is Julia Carlton. I just wanted to make sure that you all adopt the amendment to add assisted living facilities if that's what the pleasure of the committee is.
Move the amendment.
Senator Donovan, did you have an amendment?
Yes, ma'am. It's to add assisted living to the list of entities that are counted as communal living areas. So I move the amendment, if I may, Madam Chairman.
It's been moved.
Second.
The amendment is agreed to. Can I get a motion on the bill, or did I get a motion on the bill?
Move to
Senator
report
Newman?
as amended.
Thank you. It's been moved and properly seconded that Senate Bill 5090 be reported. Mr. Clerk?
Senator Sedlow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. Senator Edwards. Senator Chafin. Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
Ayes 15, no 0.
Thank you. Next bill, Senator Donovan, I think you have 6 minutes to do your next 3 bills. You want 5093.
Madam Chairman, this bill seeks to make available to high school students high-quality educational credits that they can apply to either a 4-year degree or a workforce credential that's nationally recognized. As our high school students are at home in virtual education, there's no reason we should not be supporting them getting passport credits, which now in Virginia there are 30 credits that are guaranteed to count to any 4-year university, or the didactic for workforce credits. Let's help our high schoolers achieve a step closer to their ultimate goal of participating in our workforce. This will need to go to finance. There's a budget amendment associated with it to see if we can get some COVID relief fund money to make sure that we make dual enrollment valuable credits that'll count to an ultimate degree. With that, Madam Chairman, it is the bill. It's supported by VACO. I've been in close communication with the community colleges and Department of Health on this.
If there are no questions of the patron, I'd like to get a motion.
Madam Chair.
And this bill will have to be referred
Madam
to
Chair.
finance. Yes?
This is Senator Hashmi.
Yes, Senator Hashmi.
If I may, Madam Chair, the Virginia Community College System reached out to me early this morning with some serious concerns. These courses would be offered through the VCCS, and the VCCS has shared that the State Board of the community colleges has to approve any MOUs between the college and school division to deliver the dual enrollment courses. The Department of Planning and Budget has already requested that the VCCS prepare a fiscal impact analysis of the bill, and this analysis is already underway, but we know that it will be inclusive of budgetary implications. Thirdly, the contract is about to be finalized between the VCCS and George Mason University to examine dual enrollment tuition among school divisions and 23 community colleges. And additionally, the VCCS points out that the passport courses are already available through the Online Virginia Network. If a college faculty member teaches the course, the college has to charge full tuition because the college is paying a faculty member's salary instead of the high school paying the salary. Because the VCCS has these serious concerns regarding this particular bill,
Madam Chair. Madam Chair.
Senator Hashmi, while you complete your statement.
I apologize. I might try and end
Senator
the pain
Hashmi?
Yes, I'm finished.
Thank you. Senator Peterson.
Madam Chair, I apologize for being the dark knight, but I think someone has to do it. I'm going to move to pass this bill by. I think it's a very meritorious idea, but again, I don't see how it fits right now within this special session, and we've got about 30 seconds before we start the next session. So in light of what the commentary behind me, I'm going to move that we PBI this bill and take it up in January.
Is there a second?
Second.
It's been moved and seconded that the bill be PBI. Mr. Clerk?
Senator Saslow. Senator Howe. Senator Newman. Senator Locke.
Senator Locke?
Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline.
The motion is the PBI.
Senator Peake, Senator Edwards, Senator Chafin, Senator Hashmi,
Aye.
Senator Lucas.
Aye.
8 ayes, 7 nays.
Thank you, Mr. Clerk. Senator Donovan, you have 2 minutes for 3 bills.
Madam Chairman, the next bill proposes that we offer 2 weeks of leave for our teachers if they have either a COVID exposure. It also covers days that they would have to determine testing if they were being tested or if they had a family member. Madam Chairman, one of the major issues we have in getting back to school is the concern teachers have for their safety and well-being. And honestly, teachers don't have a lot of vacation. Having 14 days off for COVID would consume all of their vacation and then some. I think it's time for the state to step forward and help fund this. There is a budget amendment that goes with it, and I would encourage us to pass this and send it on to Finance to have the conversation so that we can show our teachers that if they take this risk and teach our students face-to-face, which is so necessary, that we too will have their backs and make sure they're protected. Thank you, Madam Chairman.
Any questions of the patron or a motion? Motion, please. Do I hear a second?
Madam Chair,
Senator Newman.
I have concerns about the funding, but I would say that I would move that we report the bill and we refer it to Finance.
Madam Chair,
Senator Peterson.
I have a substitute motion.
Substitute motion?
I move that we PBI the bill. Let me make a point. Right now, we have virtual schooling. Virtual. We don't have people in buildings. So we're going to pay for 14 days of paid leave for people that are not in school buildings right now. At some point, folks, we got to wake up that this is real money. And so I'm going to make all the same points if these paid leave bills come back on private business, but we're going to put a mandate on public school divisions in order to show we're serious about this pandemic, and that's fine, but let's be cognizant of the fact that this is virtual schooling for many of us. And so we can send this to Finance. Again, I'm going to abstain. I'm abstain on any new spending bills. But honestly, I just think that this is an idea that we've gone from virtual education to virtual signaling education.
Can I get a second to Senator Peterson's motion? It's been moved and second that Senate Bill 90.
Madam Chairman, speak to the motion. I just want to say I don't think we're having time really to develop these ideas clearly, and I'm rushing through. But I want to point out that we have 9 weeks of virtual education that's proposed now. If we don't put in place some checks and measures to incentivize the schools to get back and feel like they have what is necessary for them to proceed if they do open bricks and mortar. Part of the reason they're not open is because they don't have these assurances. How long is it going to take us to get through this legislative session? We don't even have we don't even have operating rules right now. So we need to act now so that later they can be in the schools. Thank you, Madam Chairman.
Senator Donovan, I think we have a motion and a second that Senate Bill 5094 be passed by or referred to the 2021 session. Mr. Clerk.
Senator Saslow. Senator Howe. Senator Newman. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Donovan, you have his proxy.
No.
Senator Lewis. Senator Donovan. I'm sorry, Senator Donovan. No. Thank you. Senator Suderline.
No.
Senator Peake. Senator Edwards.
Aye.
Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
7 ayes, 8 nays.
Senator Donovan, you have Senate Bill 5100.
Madam Chair,
Madam Chair.
if the bill's still before us, I would move to report the bill.
Madam Chair.
Yes.
I think I think there was a substitute motion, therefore the underlying motion was the bill be reported and re-referred to Finance, and I think it needs to go to Finance. So I would hope that the underlying motion now will be before.
Okay.
Yep.
Was that the substitute motion, Senator Newman?
Yes, it was the underlying motion, so it becomes a primary motion. Yes, that to be reported and re-referred to finance. Yes,
Okay,
ma'am.
so are we talking about Senate Bill 5100?
No.
5094.
5094.
Yep.
I'm sorry, Mr. Clerk. Will you call the roll, please?
Senator Saslaw.
3 letters asking for a response.
Okay.
Senator Howe. Senator Newman.
Aye.
Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Via Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake. Senator Edwards. Senator Edwards.
You say that on there.
Senator Edwards.
Say it, Dick. Say it.
Senator Chafin.
I want to see him come through this.
Senator Hashmi.
The underlying motion is to report and refer to finance, but I can't hear these answers.
Senator Hashmi. Senator Lucas.
Aye.
13 ayes, 1 nay, 1 abstention.
The bill is reported and referred to finance. Senator Hashmi, it is now time for us to start a special session, but I don't see Lieutenant Governor, so very quickly, if we can go on to Senate bill, your next bill, Senate Bill 5100.
Madam Chairman, I think you mean Senator Donovan, and I think we're on 5095, or do you want 5100?
I'm sorry, I cannot hear.
I'll do 5100. 5100, I think, is straightforward. It basically empowers the school boards to make sure that children who are absent for COVID-19 for 14 days, that it does not count against their truancy report, so that they actually don't have trouble completing the school year if they have to be out for COVID confinement. That is Senate Bill 5100, Madam Chairman.
Thank you, Senator Donovan. Any questions of the patron?
Move to report.
Do I hear a second? It's been moved and seconded that Senate Bill 5100 be reported. Mr. Clerk?
Senator Saslaw. Senator Howe. Senator Newman. Senator Locke. I'm sorry, Senator Locke. Thank you. Senator Barker. Senator Peterson. Senator Cosgrove.
Aye.
Senator Lewis. Senator Donovan. Senator Suderline.
Yes.
Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas. 14 ayes, 0 nays, 1 abstention.
Bill is reported. Senator Donovan, does that complete all of your bills? If so, we have one other bill we can try to squeeze in. I see the Lieutenant Governor coming very quickly. Senator Suderline, you want to present Senate Bill 5105?
Oh, I don't.
It was already advanced in the form of Senator Barker's Senate Bill 580, I believe.
Madam Chairman,
That's
I
very
have
good,
two
very
bills
good.
that have not been heard. I'm sorry.
Okay, Senator Donovan, did we have one more bill in the queue for you?
Madam Chairman, we have Senate Bill 5095 and Senate Bill 5101.
Senator Donovan, Senate Bill 5095. Very quickly.
5095, Madam Chairman, the governor has entered into a compact with other states to obtain rapid testing. Rapid testing can give you a result of COVID positivity in a few minutes. And Madam Chairman, this bill simply directs that those rapid tests will be prioritized to frontline workers. There is an amendment to add firefighters and child care workers and providers licensed by DBHDS to this, but essentially anybody on the front lines, in order for us to keep providing services. This is especially important for teachers. One of the concerns about schools, and I will point out there are schools that are open, by the way, not everybody is virtual, but teachers need to know immediately if somebody in their cohort cohort is positive so that we can do the contact tracing and contain the disease, as do all other frontline providers. And Madam Chairman, with an amendment, that is this bill.
Any questions of the patron?
Move to report. As amended.
It's been moved and second that the bill be reported as amended. Mr. Clerk?
Senator Saslaw. Senator Howell. Senator Newman. Aye. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove.
Aye.
Senator Lewis. I'm sorry, Senator Lewis. Thank you. Senator Donovan. Yes. Senator Suderline. Yes. Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas. Ayes 15, no zero.
Thank you, Mr. Clerk. Senator Donovan, unless I'm mistaken, you have one more bill in queue?
Yes, ma'am. Thank you, Madam Chairman. Last bill. This is simply to add to the list of essential workers that are priority to receive PPE. That would include, I'm sorry, I'm reading which one this is, anybody in a private elementary school in the Commonwealth, primary, secondary school in the Commonwealth. So this basically envelops our private schools to be included in priority for PPE as they are open, and we need to make sure that they have access to those hard-to-obtain PPE, especially for smaller schools that have a hard time negotiating to get it in this very competitive market. That is the bill. Thank you, Madam Chairman.
Will this bill need to go to Finance?
No, ma'am. It just adds them to the list of essential workers for prioritization in getting access to PPE, but it's not a cost to the state.
I heard a motion and a second by Senator Newman. Mr. Clerk?
Senator Saslaw. Senator Howell. Senator Newman. Thank you. Senator Locke. Senator Barker. Senator Peterson. Senator Cosgrove. Senator Lewis. Senator Donovan. Senator Suderline. Senator Peake. Senator Edwards. Senator Chafin. Senator Hashmi. Senator Lucas.
Aye.
Ayes 15, no zero.
Thank you very much, Mr. Clerk. This completes the calendar. And if all hearts and minds are clear, the committee will rise. We've run a marathon.